Uh, Studies show a correlation between high childhood IQs and getting high. We're talking about weed here.
Yes.
Using data from the 1958 National Child Development Study, researchers published a report last year that found that children who have higher IQs were more likely to use illegal drugs later in life. Again,
According to a groundbreaking study done by NASA scientists, most people are born geniuses and education dumbs us down.
When we talk about cancer a little bit, various types out there, what are some of the things that you've seen in terms of your patients, and what some of the things that you've been able to do?
A better thing to talk about in relationship to, well, I will talk about that, right? A better thing to talk about, however, is the relationship between profits and cancer in the United States. There was a study that was published, I believe it was in 1994. It was a 12-year program, 12-year study. They looked at adults who had developed cancer as an adult, not childhood cancer, but adult cancer, right? And this is the main types of cancer that we get here in the United States. They did a meta-analysis of these people all around the world who developed cancer as adults for 12 years and were treated with chemo. And they looked at the results. And they published the results in the Journal of Clinical Oncology. And the results? 97% of the time, chemotherapy does not work. 97% of the time, it doesn't work. So why is it still used? It's one reason, and one reason only: money. If you go to a medical doctor, an MD, with a sinus infection, and that doctor prescribes an antibiotic, he gets no financial kickback. Now, if he prescribes 5,000, of that antibiotic in 1 month, the drug company that makes it might send him to Cancun for a conference, right? Mm-hmm. But he gets no direct remuneration. It's not with chemotherapeutic drugs, it's different. Chemotherapeutic drugs are the only classification of drugs that the prescribing doctor gets a direct cut of. So if your doctor prescribes chemotherapy for you, here's how it goes, more or less. The doctor buys it from the pharmaceutical company for $5,000, sells it to the patient for $12,000, insurance pays $9,000, and the doctor pockets the $4,000 difference. And there ought to be a law. The only reason chemotherapy is used is because doctors make money from it. Period.
I intend to bring forth heaven on earth for the benefit of all, and release all beautiful souls from bondage. X marks the spot. Blot up, shut the fuck up.
for the last time, no dirty pizza boxes or polyethylene-coated coffee
I'm trying,
cups.
all right? You don't have to be a dick about it.
I'm being a dick about it for the children!